thank you everybody for joining us. We're already running a few minutes late. And my name's Steph McLaughlin, and I'm facilitating today. And so what I thought we would maybe start off doing is we would just go across and introduce people as they occur on my screen. And then what we'll do is we'll come back, and we prepared a few questions ahead of time that we'll just kind of work our way through. And obviously the intent here of the session is really to explore kind of community engaged or community driven research, and how it's been affected by the pandemic, and ultimately what might be done to make it work better, regardless of whether there's a pandemic or not. And so we have a wide diversity of panelists today, and so that's amazing, and basically coming from across two provinces at least, kind of in terms of the work that they're doing. So my name's Steph McLaughlin. I'm a prof at the University of Manitoba in the Faculty of Environment. I'm one of the co-leads, I guess, on the larger project and also the gathering. And so thanks for joining us. So I'll just kind of read people as they occur on my screen. And so we'll start off with Megan.
Great, thank you. Hi, everybody. Nice to have you all here tonight. My name is Megan Firth, and I am a social scientist with Integral Ecology Group. We're a team of multidisciplinary professionals based out of BC. Myself, I am located in Montreal, but we work mostly with communities in BC and Alberta. So yeah, looking forward to getting to meet all the other panelists and hear about your research.
Perfect. Thanks, Megan. Okay, Lolita, you're the next person on my screen.
Hi, I'm Lolita Lattiser. I'm the Community Development Manager for Fort McKay First Nation. My role is mainly community engagement, and I lead meetings or workshops, or also engage people with research projects, and then that's pretty much my role, is engaging people, especially during the pandemic. It's been really hard because we've had a number of people on our team who haven't been able to work in the community. So I'm the go-to person for Fort McKay.
Okay, perfect. Thank you. It's great. Thanks. And then Thomas, you're next.
Thanks, Steph. Well, it's a pleasure to be here and see all the faces and to have a discussion today. My name is Thomas Dick, and I am also with Integral Ecology Group. So Megan and myself work closely together. As she said, we do a lot of work with supporting Indigenous communities in BC and Alberta primarily, but other places as well. I have, I guess my background is in social science, human geography, and I have the pleasure of working with Lolita and Angela, who is potentially coming yet. I don't think she's made it here yet. Maybe she has. I'm not seeing her. But yeah, working with Lolita and Angela has been really great, and I hope we can talk a little bit about some of the things that we've done together and other things. But yeah, it's great to be here. Thanks.
Perfect. Thanks, Tom. And then we have Siobhan next on my screen.
Hi, I'm Siobhan Sinclair, and I'm from Hollow Water First Nation in Manitoba. I am living in Winnipeg, and I am part of the digital app project for community research out of the University of Manitoba. And like Lolita, I am mostly focused on community engagement and implementing the project. Miigwech.
Thanks, Siobhan. And then finally, but not least, and we're hoping that Angela joins us, but Mura.
Good evening, I guess is the proper word. I'm Merle Ballard, and I'm an Anishinaabe from the Ixon Martin First Nation. I'm a prof at the University of Manitoba Faculty of Science. And my role, I guess, is at the other end of the spectrum, researcher mostly. Yeah. I've done a lot of research regarding land, water management, and with this project with environmental health impacts, etc. COVID. Okay.
Well, that's great. Thanks, Merle. And then maybe Dylan, if you're able to keep an eye out for Angela or whomever, and I'm sure she'll join us at some point, or hopefully she will. Okay, so so it's kind of interesting. So we have research which cuts across a number of different provinces. We have a mix of kind of folks who are non-Indigenous, who are researchers, and people who are Indigenous. We have a mix of community folks, and so it's a diversity. There's another interesting diversity here, which is we have some folks who work with consultants primarily, and other folks who are obviously affiliated or work with universities, and so that should make for an interesting discussion. I guess in a sense, what I thought we could start, each of us, was just beginning by talking about kind of some of the characteristics of good community engaged research, and thinking here in the context of the pandemic that we're all talking about, kind of focusing in a bit more on that and just talking about what people see as being kind of the hallmarks or best practices, I guess, around community-led or community-engaged research. And maybe kind of first time round, we'll kind of start here with, we'll start with Megan if we can.
Great. Yes, I also just got a message from Angela that she's recovering from her second vaccine, so she will not be joining us today. But yeah, I'd be happy to talk a little bit about some of the things that have been working on our side, and some of the work that we've been up to, and how we do things at IEG. So yeah, basically, as a company, IEG supports, as we mentioned, a number of communities, including Fort McKay First Nation. And we work really closely with Lolita and Angela from ACFN, who won't be joining us today, unfortunately. And yeah, our work revolves really around them and the great work that they do and their connection to the communities. So basically what we do, or how we work, is we try and build really solid relationships and connections with the communities that we work with. Most of our connections, if not all of them, are really long-term relationships. We've been working with Fort McKay First Nation as a company over time for over 15 years. So we really get to know people who work in the offices as well as the community members. And so, yeah, basically what we've been doing is supporting community members and the communities to understand how they're impacted by changes in the environment and changes to the way, their way of life. And so we always try and start off with trying to understand what community questions are, what are people interested in, what are they worried about, what are their concerns, and then we build from there. We often spend a lot of time, when it's not COVID, out on the land, with land users, and trying to understand, what's important to them, and again, trying to find answers to their questions. So yeah, that's typically how we work. With the pandemic, things have, of course, shifted quite a bit, as we can't spend time in communities at all. So we're not out on the land, and we're trying to figure out ways to adjust what we're doing, and still make sure that our work is meaningful, and the engagement that community members are having with us to answer those questions and answer those concerns, is done in a meaningful way. So I'm sure we'll get more into that as we go through, but yeah, that's kind of a first glance.
For sure. And maybe Tom, because you work for IEG as well, is there anything you wanted to add to what Megan was saying?
Yeah, sure. Thanks. I mean, Megan's said a lot of it, and she said it really well. I, sort of thinking in the context of the pandemic. I mean, it was a real struggle to kind of figure out, kind of how do we do meaningful engagement in the context of you can't, meaningfully sit together in the same room and have conversations and hear and listen to people. Some of the greatest challenges related to uh, um, uh, just technology and all these kind of different factors sort of really got us to really think again about what is meaningful engagement, and how do we think about that in the context of the stuff that needs to get done, and how members can contribute to those processes. I think if the question is sort of what are the best practices, sort of, or what are our kind of lead components to sort of engagement throughout the pandemic. I mean, flexibility was probably one of our kind of backbones, I guess, in the sense that, working closely with communities. I mean, Lolita said it too, right? She's been kind of like a key role in work still happening in the community, because she's there and she's able to work within COVID restrictions, and we're not. And so being, the community being able to organize in a way that can facilitate the things that need to happen without or while still keeping everyone safe has been, I think, a challenge, but also a really amazing aspect of how people have come together in a sense, right? Like prior to the pandemic, we would have been in the community doing some of that work, and now that we're not in the community, I think community members are doing that work, and I think that's fantastic. And so that's been an interesting kind of approach sort of during the pandemic. I'll leave it there and save some stuff for later.
No, thanks. And so for you, Lolita, just building on what Tom was saying, so do you think it has created opportunities for folks in communities in a sense, or are there other pluses that you can see, or ways that people have adapted to better work within a pandemic context?
I think for us, it's mostly just been relying on the staff that is in Fort McKay, that's living in Fort McKay. So we've been able to mentor some of the staff in things like studies that were being conducted. So that was a positive role for them, because it helped to push them out of their own shells. I think, as Tom said, the biggest thing is flexibility. So with us, we have a lot of elders who weren't used to technology. So they were actually able to connect. But what amazed me more was having the youth involved, because in prior years, we had a lot of elders or older community members doing a majority of the research projects or a majority of the community engagement meetings. And during the pandemic, we were able to bring in a lot more youth. So for us, that was a positive step, because the elders always say the youth is what we are fighting for. And I guess having them be a part of the engagement is really been a plus for us as a community.
Right. Wow. Perfect. That's great. That's really important. And so then thinking more about the Manitoba or Northwestern Ontario context, and I'm just trying to see if Merle, are you there? I heard your dog, I think, barking in the background a little bit.
Yeah, I'm here.
It's funny how they always wait until you're ready
I
to
know.
talk and they start barking. It's
Sorry, a bit distracting.
so what about you? Maybe talking a little bit about kind of some of the the research that you do and kind of how it's, in a sense, some of the good aspects or kind of before we get into some of the challenges and barriers, what's suffered, kind of talking about what's working in the context of the pandemic.
Yeah, for me, I guess I don't use the word meaningful engagement because I am a First Nation, and the people that I visit are in Anishinaabe. That's what I call them. So there is a difference between, to me, meaningful engagement is another term for consultation, which the government uses as part of its duty to consult. So I don't use that term. I use the term for my when I visit Anishinaabe. I use the term I'm visiting because that's what I'm doing. In Anishinaabe means my own kind, and there's a difference. And the way I get them to share is by listening to stories, learning from them, sharing, and they share with me and I share with them, and it's all experiential because it's a learning process. It's still a learning process. And there's a lot of challenges too because of there's a lot of challenges when you want to go out there to the community because a lot of people don't have the infrastructure we have, and they don't have the resources, so they don't have the access, they don't have a connectivity. The internet, the speed is not there. With some communities they do, but a lot of them, simple things we take for granted. For example, a cell phone. They don't have a cell phone services in a lot of communities. Once you go past that invisible border, the service ends, and it's because that the provider cannot go in there. It's because of money. Do they make enough money from the community in order to put a tower there? And these are all these things, and there's a lot of things that restrict the work that I would normally be doing. I work with the elders mostly, and a lot of the elders don't even have an email, and these are some of the challenges. They don't know Zoom, they don't have a tablet, they don't have a computer. A lot of them don't have a cell phone. So these are the challenges. Okay,
perfect. Thanks. Siobhan, did you want to add anything either to the kind of what you've seen working and how people have adapted, or following up on what Merle was saying in terms of some of the challenges?
Well, first off, I do want to say, I'm kind of happy to be part of this panel because it's going to help me moving forward with the communities. So the first thing I would like to say is that I really like the idea that the comments made around, building relationships in communities, and those relationships really need to be focused on long term. And that's kind of how I got into this project too, was because initially I spent over 15 years working with communities. So, that's a long time to be working in different communities and at different capacities too, health, land. At some point I was even involved in consultation. And, so all these things, when we talk about building relationships, it really does need to be long-term. And that is how I feel like I've built my respect to go into communities. And one of the barriers, like Merle had talked about, working with elders, that is where that's how I got to work in communities. The elders really welcomed me through their meetings. And it is a challenge working with the elders because like Merle said, you know, there's limited access to connectivity, the resources. My experience working in communities, you know, Merle talked about funding and resources. That's always the challenge in communities. And working in health the last 5 years was strictly focused on finding the funding for the communities. And I'm telling you, like, that is how I became so interested in this project, because I knew working with funding, working with designing programs, setting up programs, implementing programs, I automatically knew, and like the health directors knew, we needed our own data, you know. So that is kind of why I wanted to be involved in this project. So that way I can kind of be that gap, or not be the gap, I mean, build that bridge for communities. And yeah, so, but connectivity is always an issue in the First Nations. Even with the connectivity packs today with this project, like, it's working for the young people, but it's we still have, there's a lot of barriers when you're serving the older people, you know, the elders. For example, I've ran into a situation where language was one aspect of it, so I needed a translator. Then on the flip side of that, you know, we had to read questions to the elders, because, you know, there was some couldn't see, some had trouble hearing. So there was a lot of barriers. But the one thing I can say is that because of the community's, I guess, relationships, they are able to work around those barriers to get the job done. So yeah, that's all I'm gonna say.
No, thanks, Siobhan. And so when we talk about connectivity packs, that's for this digital app project. And so it's all obviously internet based, and it obviously falls apart if you don't have good connectivity. And so these are local area networks, the mobile stations that have been designed to let people work with things like mobile health or apps of any sort, even when there's really poor connectivity. So I'm just kind of providing that context. It struck me that when you were talking, that another, in a sense, plus that's kind of affected us is it's like, I think historically, kind of at least kind of in the recent past, there's been an assumption on the part of the communities, and you spoke to this earlier, Megan, that you would kind of, it would be totally emic, it would be very much located within a given community, right? And then you would put all of your resources into that. But suddenly, with researchers not being able easily to go to communities, say for our project, it's enabled us to reach out to communities across the country in a way that we perhaps normally wouldn't have been able to, because there still would have been that assumption that we would go visit them and spend time within them, where of course for communities that are in lockdown, that isn't an option. And so it's kind of created flexibility in that way. So what about then, so we've talked about kind of what's—
Can I make a comment?
Oh, yeah, for sure.
Yeah, the reason there's two things that to consider here. Because when you work with mainly with communities, for example, doing research with communities, the virtual world is very, I wouldn't say easy, but it's easier than going into the community. But when you work with this, like the kind of work we're doing, the research we're doing, we're dealing mainly with the band offices or with the health centers who have the technology. And if we work directly with the grassroots people, we would run into a lot of barriers.
Yeah. And so you anticipated my next question, was thinking, and so building on that, what Merle just said, and maybe I'll open it up to anyone who wants to speak to this, is kind of what about things that have been aggravated or made worse. And so in a sense, what Merle's saying is that within communities, that there may be haves and have-nots in terms of who you can access and who you can't as a researcher from outside, dependent on those virtual means. But maybe there are other things that people want to comment on in terms of what's been made more difficult, and perhaps there haven't been solutions that are found. And so did anybody want to speak to that?
Yeah, I don't mind to go next.
Okay.
Yeah, I mean, one of the challenges that we've been facing is really connected to, I think, what you were saying, Merle, about technology and trying to reach everybody who wants to participate in the process. And so we're in the middle of a project now with Angela. I was hoping she'd be here to share a bit about it, but I'll try and do my best to fill in some of the details. But we're trying to, as a part of the project, document some traditional land uses that are happening from community members in Fort Chipewyan with Athabasca Chipewyan First Nation. And, you know, typically that process would be Tom and I sitting in an office with people and, you know, having a cup of tea or coffee and getting to know them. And if we don't already, and spending some time, you know, one-on-one with them, and having our screens so we can provide them with a laser pointer or whatever, so that they can show us places that are important and that they want to have included in the project. But of course, that's not possible, and a lot of the people who are participating in these types of projects are often elders. And so we've been working really closely with Angela to try and figure out a solution. We don't know if it's going to work yet because we're just about to try it out, but we think we've come up with a bit of a workaround, which relies quite a bit on Angela to use an iPad. We've purchased, you know, a large sized iPad, and she set it up so that she can drop it off at someone's house and it's all ready to go. So that person doesn't need to know how to turn on an iPad or how to answer a phone call or a Skype call or a Zoom call, whatever it may be. And she's figured out some ways to, if they're interested, to, you know, draw on the iPad with their fingers so that they can point out places as we're, you know, verbally talking through things, and she'll be available outside in case they need some help. So we're still in the kind of trial phase of it, but kind of interesting, trying to think of ways to, you know, keep including people who want to be included in these projects despite challenges. And I mean, in Fort Chip, we're lucky because there is cell connection, so we're able to connect the iPad that way, which isn't the case in all communities. So yeah, I'll let someone else speak.
Anybody want to chip in? Anybody else want to chip in on that?
Megan, I have a question. Sorry about that. Is phone use, like, in your experience, did you guys use phone like as a means to collect the data? I just have that question.
Yeah, I mean, we're just starting in this project in particular. We're just about to start. So we're thinking the iPad's kind of the best case scenario, because it allows them to see Tom and I, you know, and they can see the map if it works. But if it doesn't, then phone is kind of the next best
Okay.
option, we think. So that'll kind of be the backup, if you will. Yeah.
I just need a backup plan.
I just want to jump in here. So for this, we have a lot of issues with internet service in Fort McKay, especially with all of the homeschooling that has been going on. So we have a lot of members on the same service provider. So it's not necessarily a stable thing that you can use for Zoom meetings or Teams meetings. So when we were conducting a study earlier on in the year, what we found was some of the elders were comfortable with, they were all given iPads that had the technology in place. Part of this was through some special funding. So they were set up, and we had one of our community health reps go into the homes and assist the elders in connecting on these iPads for the meetings. Those that weren't comfortable, because there is some of their elders who still refuse to even touch a cell phone. When we were doing those research questions, we actually made numerous phone calls to them. And with the phone calls, we also had delivered the paper copy of the questions. So they were able to look at things like the pictures if they couldn't read or write. And then we were able to explain those questions in words that they would understand. So it made the process a little bit easier. And then as we were conducting that phone survey, we would ourselves be typing the answers into the questionnaire on the computer. So you were still able to get the data. You just had to do it a little different to get those elders involved in participating. But they were really happy. Like I was telling Tom, they were actually happy that they had somebody to talk to. So you spent a good hour for every interview that would take normally 20 to 30 minutes. But it was nice for us as community members to get to know everybody. So that's just my little thing on technology, is sometimes you have to go back and revert to the old-fashioned way of just the phone call.
So, so Tom, you haven't spoken for a while. Is there anything else that you wanted to add in that regard?
Well, I had some technology troubles, but I think I'm back now. So I hope
Okay.
you can hear.
Well,
And to
good.
refer to my phone. Yeah, I mean, hearing stories like that, Lolita, about the project that we worked on together. I mean, it's just great to see that kind of adaptation in a really not ideal kind of world, right? One of the things that it kind of reminds me of a positive aspect and sort of a way to maintain relationships and those connections was for a different community. I was asked by some of the community leads there to actually reach out to elders and have some conversations with them, sort of not necessarily about the research itself, but just to continue to maintain and build those relationships, because they're so important. And similarly to Lolita, what you said about the value of that and how people really do want to reach out and connect. I felt that too, and I was really not as familiar with that community as I might be with some of the former kind members. So, that building connections and that building relationships, I think, was able to continue, even though I couldn't be in the community and show my respect and show my interest and sort of gratitude for being there, but I was still able to kind of maintain that sort of connection and hear them, and they felt like they were being heard, I think, and we weren't necessarily talking about research, but hopefully, when there is a day when I can go back and work alongside potentially the community researchers that we've sort of worked with, they'll remember me and we can continue on to sort of build that relationship.
Right. No, thanks for that. I mean, it struck me as we were talking that the projects that are successful perhaps are the ones that have really good resources, right? Regardless of whether the fund comes from industry or from government or what have you. And sometimes there's also a tendency, especially if we're dependent upon connectivity for a lot of these things, despite some of the innovations that we've talked about, that it's also for communities that are really well resourced. And so what about, like, if we think about it, kind of this idea of inequity and how some communities have advantages over other communities, in the context of a pandemic, do you think there's a inclination to become, in a sense, for some communities to actually to be hurt more than others by something like that, whereas we, depend on all these kind of external measures of communication? And I don't know, Siobhan and Merle, do you have any kind of comments around that?
Can you repeat what you just said?
Oh my Lord. Okay. That was a long response. And Merle was probably thinking, oh my God, I hope he doesn't pick me. He always ends up picking me. So this idea that it's because Siobhan was listening, so it's no, but the idea that that in some cases that it's the communities that the have-not communities that have the poor connectivity and who don't have resources, that don't have connections with universities or consultants, someone's got to pay for those consultants that in a sense fare worse. Maybe I'll start with Siobhan and then we'll get back to you. Well.
Okay. Actually, that's a good question and comment, Steph, because that is something that I'm dealing with. In one of the communities, there's better connectivity, there's resources there to support different initiatives. But in the other community, there's some barriers around connectivity and then resources. So what I've been seeing happening is like for example, the community that's lacking those resources like connectivity, the devices or the supplies, what I see happening all the time is that communities are always trying to find ways to access those resources to support different projects. And you're absolutely right. Like some communities have relationships with other consultants. Some have relationships with the post-secondary institutes. Some have resources with tribal councils, and then some don't. And that's always a challenge. So each community that I work in, I find there's different barriers and it looks different in each community. So that's my experience. And so we're always trying to figure out ways how to work and navigate through those barriers. And connectivity is always one issue that we have to work with. But saying that, I can also say too that I'm very proud of the communities because they do wonderful work to work around those barriers at all levels. So that's what I will say.
Perfect. Merle, did you have anything you wanted to add on that?
There's a lot I can add, but because I've been working with the communities for a long time. I've been working with them. I work with communities at the local level, regional, national, and I work with the communities at the international level as well. And I'll give an example with my community. There's a lot. My community was displaced, 100% displaced. And I used to work for the community when we first got displaced in 2011. You should have seen all the consultants every day piling into the band office waiting for like money. Like, oh, it was so disgusting. Like they were just after anything to do work for the community. Oh, we can do this, we can do that. It was so disgusting. And they're still there today because my community is so stressed, has been under stress. They've been evacuated. They were evacuated the other day again because of forest fires. They were evacuated during the winters because of ice storm. The list goes on and on, always evacuated. There's so much stress and there's there's no resources. The consultants that think they have a lot of money and they don't. Like they're just struggling from day to day, and there's so many problems, addictions, you name it, resettlement. And some of the consultants, when there is money coming in, they write a proposal, then they take a 50%. They take 50% of the funding for their own, to pay themselves. There has to be certain laws against that protocol. That's robbery. They're just robbing a poor community, and they don't do them properly. And there's just no. I'll just leave it there.
Right. And chances are, just like there's good university researchers and there's terrible university researchers, there's good consultants and there are terrible consultants, right? And one of our colleagues, calls the ones that just take and don't really give anything back predatory consultants, and yet obviously there's kind of organizations like IEG who are trying to do something different in that regard, right? And so. But in that regard, I mean, it strikes me, I mean, and you brought it up, Merle, and we have kind of maybe, 10 or 15 minutes left, is this idea that if you think about research and the history of research, what's been done under the guise of research, and this is certainly the case for medical research, but arguably for research as a whole, is this idea, and Linda Tuai Smith, who is a kind of internationally recognized Maori research from New Zealand, talked about how research was kind of basically a dirty word in the indigenous lexicon, right? And that book was written almost 30 years ago, right? And she's written kind of editions, and she hasn't changed that part of the book. And so I guess what I'm wondering is, thinking about where research needs to go, and thinking in a sense what is still done poorly, and addressing some of those, and how to kind of move forward and make research more accountable. What do you think in that regard? Thinking about the future, what do you think research, regardless of whether it takes place in the context of a pandemic or otherwise, how does it have to evolve in order to really serve the needs and the priorities of Indigenous communities? And I could open it up for anyone who wants to speak to that. Just don't feel afraid of being rude. Just jump in and talk.
One of the things, because I'm a fluent Anishinaabe speaker. I speak my language, and that's my first language, so that's my mother tongue. A lot of the terms that we use in Western, with Western knowledge, I'll call it, we don't have those words in Anishinaabe, and it's so hard to try to translate them. You can't even, there's absolutely no word to translate. It doesn't, there's no concept. That word research, we don't have that word. If I were to try and translate that word, I wouldn't be able to. The closest word I would probably translate is Andonege, which means looking for. And that's not what it is, but that would be the closest. And there's so much more that needs to be done regarding research. I'll just use that word research because I am from both worlds. But there is so much more that needs to be done regarding protocol, establishing the right protocol. One of the things too is getting communities involved. We're always rushing at the last minute. Maybe some of these can be alleviated if we develop partnerships. We need to develop partnerships because a lot of research requires the letters of support to the partnerships, and a lot of times we're just running around at the last minute, and I hate doing that. Like, I don't want to go to a community. Would you come on board? You know, I'm a researcher too, and these are the things that I struggle with. Being a First Nation, I know what's at the other end. They don't have the capacity to write to the letters a lot of times. So I know what. And these are the things I struggle with, I guess, as a prof that's required to do research.
Right.
You know, I do it, but you know, I try and think about things before I go, you know, set out my plan.
Mm. And as Betty Karpik wrote here in the chat function, if you didn't, she wrote a comment here, and she's talking about how there's a danger that by doing research that something traditional is lost, something that's more nuanced, that is not brittle, it's not black and white, and you know, she talks about verbal and nonverbal cues that require lots of decoding, and so kind of in a sense what gets changed by doing the research often is kind of undermines those traditions. And so did anybody else want to speak to this idea of kind of the future of research that works with Indigenous communities or for Indigenous communities?
I don't mind to go next. I mean, kind of going again back to our context, which is a bit different from the academia sense of research. You know, we're often asked by the communities that we're supporting to try and answer community questions or concerns that community members have. Like the project we were speaking about with Lolita earlier, you know, is really community driven in terms of a question that kept popping up, and there was a lack of data for the communities. There was 3 communities involved to answer those questions that they had. So yeah, I don't know, for me, for the future of research, I think I'm happy that the fact that the research and the work that we're doing and we're supporting is community driven and community led. But I would definitely like to see more community members being involved in the projects, and you know, whether that's more community researchers being involved in implementing surveys, or being out on the land and you know, documenting traditional land uses, like Tom and I are sometimes out doing when it's not pandemic. Yeah, I mean, really just a transition from us doing less to community members and community researchers doing more, and just kind of shifting that dynamic, I think would be, in my mind, really positive. And, you know, especially we've chatted a little bit about youth, but, you know, we're always interested in bringing youth when we're out doing activities, trying to have them come out and learn and participate with the elders that are there. And yeah, I think that's something that's really important going forward, is just finding more opportunities for that transition and to start happening.
I would like to say that in respect to like what I think needs to happen is that when we want to have research with First Nations, I think like we really need to focus on that relationship, because sometimes what happens is a lot of the times that research that is conducted, it doesn't really belong to the community, and it doesn't really stay with the communities. And then sometimes that whenever a concept is developed or created with community, then sometimes they don't get that recognition. So that is kind of, again, like why I was attracted to this project, because it, again, like it's kind of reshaping and that relationship between First Nation communities and research. So for me, I think that like that needs to change. Like we need to, as if we're going to say we're researchers, then we really need to work with communities and make them feel comfortable that these concepts, these whatever it is we get from there belongs and give them credit for it. Because I know from experience, like growing up in my community, Hollow Water, there was so many projects that came through there. But at the same time, like we found out through time that a lot of the times our community didn't get recognition for the projects that were conducted. And that has been a major barrier, because when I go meet with the elders or the youth or the health or the council, they're like, what are we, like, is this going to be ours? Or are we going to have someone, you know, come and take our work and claim it as their own? You know, those are the type of responses that I deal with. And it's hard, because I know at the flip side of it, I know that data and research is so important. But at the same time, it's kind of hard too to rebuild that relationship, to tell the community that this is good, like this won't happen to us. But when it did, you know, so it's really, really challenging. And I'm speaking from the perspective of my personal experience from being in my community. We've been researched since the 80s. And you know that, and it's sad sometimes, but at the same time, I'm happy that those studies were done, because it allowed us to reference something. Because again, when you're applying for funding or doing projects, you need to reference something. So in a way, I'm happy that those projects happened, because at least we have a stepping stone, you know. And moving forward, I would like to see that relationship change. And I would like the community that I'm from to flip that and to have that relationship, because I know there was a relationship there and it was a positive one. So I would like to see that come back.
And so we only have a couple more minutes left, I think. And so Lolita, did you want to add some final comments in terms of where you see research going when you think about your community?
So as you may or may not know, we're kind of in the middle of all of the mining companies. So we do a lot of work with researchers. We do a lot of work with consultants. But the uniqueness is that we've learned from the past with all of the studies that were conducted. And we do keep ownership. So the recent project that we worked with Tom and Megan on was a study that our communities did, but we have some ownership into that. And we have a database that's built up from all of the TLU studies that we've done. So for us, it really has been important for our work with industry. But we've also learned lessons. So a lot of ownership has been maintained by our community. So for us, when we work with consultants like Tom and Megan, it's a positive impact for our community. So I think that's just important, is like that ownership needs to be there, and that trust when you're working with consultants.
Right. And so for me, and where did you have one final quick comment to make, Tom, before we end it?
Oh, just thanks, Lolita. I mean, yeah, it's I you know, if it was up to me, I feel like we would support, if the community needs our support, it would be on things, less and less, because you know, I've seen myself, your community, Lolita, has grown in that way in so many different ways, and so it is kind of really neat to see how that capacity over time does build if the resources are there.
Right. And
Thank you.
so, perfect. Thanks, Tom. And so just kind of summarizing here, I mean, obviously, kind of things have been made much more difficult through the pandemic. And it sounds like we all, as researchers, some of us being consulting researchers who work directly for communities, and others kind of more autonomous, kind of university affiliated researchers, but all that see the value in working with and for community, that things have been made much more difficult through the pandemic. And yet it sounds like we've all found different ways of kind of persevering despite those barriers, and still kind of delivering on those important outcomes and processes. It did strike me, though, that as we were talking, that one thing that has been made clear to me, and so I work for an institution, as does Merle, and indirectly Siobhan, that kind of, we're talking, when you include students and profs, you're talking 30,000 people, right? 35,000 people. It's basically the second largest city in the province. And it was very clear to me that as soon as the pandemic struck, despite University of Manitoba talking about how it valued Indigenous communities and did everything it could to support communities, whether it's through education or especially research, as soon as the pandemic struck, they just walked away. They shut it down. And at the time when those universities and those researchers were needed the most, it was very clear that they were just kind of protecting themselves, and that was a kind of a superficial kind of commitment, even though it appeared on the surface to be a genuine one. That what it took was a pandemic to show just how little has changed from my perspective, working with universities, and in a sense, how much needs to be changed in order to make real differences. And potentially consultants are different in that regard, but that's the case here. So thanks everyone. That's kind of a gloomy way to end, but saying that there's still lots of heavy lifting, I think, to do, to in a sense, if, as Merle and certainly Siobhan was saying, if very little has changed despite sometimes decades and decades of research or presence, and that's something I think that all of us need to think critically about and figure out how we're going to do things differently moving forward. And so thanks everyone for sharing. Thanks for those who shared within the chats. Have a great evening, and then hopefully we see you tomorrow in the gathering for the last day. Thanks everyone.
Thanks, Steph. Thanks everyone.
Thanks, everyone. Have a great evening.